You know, we all have had moments when we feel sad and down, and we think, oh, we have depression. But actually, there's a clinical condition called depressive disorder. You might have even heard it called major depressive disorder. And that's an actual condition that causes you problems and impairs your functioning. It starts with a core symptom, which is feeling either depressed, down, blue, or not caring at all, apathetic. And that lasts for at least 2 weeks, but usually longer. On top of that, you might have problems with your appetite, feeling too hungry, not hungry, gaining weight, losing weight. Your sleep, you may have trouble falling asleep, staying asleep, or getting up too early. Or you may be sleeping too much. That is a sign of depression. You might feel worthless, like you have no point. You might feel hopeless. You might even think about taking your life. You might be slowed down, and sometimes people actually get agitated and revved up. But these are all signs that you might have major depressive disorder, a condition that is treatable. So check in. You can start with your primary care clinician. You know, sometimes people think that they have depression because of an event that happened. And that event could really contribute to depression. But a lot of times, whatever event you've experienced, most of us have experienced and haven't gotten depressed. That's because depression involves biology, psychology, social factors, and environment. It's a whole bodily response that affects the way you are with people. We don't really know always what's going to cause depression. Often it comes out of the blue. But we do know that things like prolonged stress, that lowers your cortisol. We do know things like thyroid disease or kidney disease. Those kinds of things can lead to depression. And by the way, certain medications can also lead to depression. So it's important to talk to your primary care doctor and have a consultation about your health and well-being. If you think that you might be having depression, if you're feeling depressed and you're not functioning well, get screened. You can go to your primary care clinician, and they have a questionnaire that you can fill out. It talks about your mood, it talks about your appetite, your energy, your sleep, and whether or not you're thinking about suicide. It's just a few items that are related to what we know about depression, and you can fill it out, have a conversation with your primary care doc or clinician, and see what next steps need to happen. If you feel that you can't go, which sometimes when you're not feeling well, that's what happens, ask a friend or a family member to go with you. It's not hard to get screened, and it's the first step in feeling better. For more mental health resources, go to cvshealth.com or afsp.org.